What's up, party people? My name is Sunny Ray. This is the Sunny Ray Show. I have my fourth guest for the day. Still can't believe I get to talk to really awesome people. My next guest is his name is Gary. He's an entrepreneur helping to solve a problem in professional sports injury using one of the AI disciplines, knowledge graphs. And so, with that said, I'm going to bring Gary on stage. How you doing?
Hello there. I'm doing very well here in New York on what is now a sunny day, not a rainy day, which is nice for a change.
I love New York, Gary. I think I was telling you on my last call. I was just there 2 weeks ago. I took my family there. I took the three little ones for the first time, 11, 8, and 2-year-olds. And oh my goodness, did they ever have a blast. In fact, today I asked them, I'm like, so what'd you guys think of New York? They were all like, we loved it. We loved it. So lucky you. Maybe the next time I'm in town, we can grab a beer or coffee. What is it that you are building? What is Athletic Insight? Yeah, give me a elevator pitch, as they call it. We'll keep it short and sweet for now, but we'll go deep into it later.
Well, the elevator pitch is pretty straightforward, and people that watch sports and play sports are all very familiar with hurting themselves. And over 68% of those injuries are what is called soft tissue, which is a sprained ankle, a pulled muscle, a tendon, a ligament. And we all know how difficult and painful that is. But the other challenge is that when it's diagnosed, the diagnosis using whether it's an X-ray or an MRI or just somebody's hands doesn't actually capture the full injury. And when we look at professional sports players, for example, a recent basketball player hurt her lower leg, but just as the lower leg was healing, there was a hip issue that kept her off the court for another extended period of time. But realistically, did she hurt the hip, or did it just radiate from the lower leg? And what we call sympathetic pain, when you hurt your ankle and your hip hurts, because while you're favoring your ankle and not walking on it, what you're doing is putting strain on another muscle. So if the doctors and the whole medical teams can improve their ability to diagnose with more imagery together at the same time, then they can do a better treatment process to both isolate the treatment of the injury, ideally prevent it from radiating someplace else. And in professional sports, a statement of return to play is a big deal because when a player is off the field, it costs money, both to the player, the league, the team, everybody. When the player returns to play, their revenue improves, the team revenues improves, broadcasters, everybody makes a lot of money. So it costs money when the player is injured, and return to play reestablishes the revenue stream. So what we're doing is we're saying that all of these great imaging systems that use their own technology to look at it, we would be partnering with them to bring all those images together so that after they produce the image, an X-ray, an MRI, a CT scan, things like that, that the medical profession, and using what we call knowledge graph AI, find the commonality in all of these so that when the medical team is looking at it, it visually shows them a full representation of the injury. So that's what we're doing. And right now, to the best that I know, no one else is doing it. And we're raising our first round and looking to get into the marketplace.
You know, the tech pulls the data together, but how do you get doctors to actually trust it for return to play calls?
Well, very simple question to answer, because again, if a doctor takes an MRI, the doctor looks at the MRI. Nothing's changing there. The doctor also looks at an X-ray. Nothing changes there. CT scans, all the tests that the doctors look at. The problem that the doctor has now is for them to look at all of those images. They're staring in front of a computer, not touching the patient and toggling between all of those applications to look at them individually. So what we're saying is if we can take the images that they're now looking at individually, bring them into one screen so they can be looking at the MRI with the X-ray, with the CT, with any of the other tests that are taken, it gives them a complete 360-degree view of it. So we're not diagnosing, we're not reading it. What we're doing is we're saying that we can use technology to identify across each of the platforms the images that have the same commonality of information, and then bring it in front of the medical team that looks at it with knowledge and experience and say, oh, look, the tendon, the ligament, everything about around that space is showing injury. And if we can target our treatment for that injury, we can treat it better because we can target it better, and we can improve the return to play timeline because it's being treated more successfully. We're working with a team that are using humans right now that have experience in reading sports MRIs. And when you have a professional, when you have somebody that knows a sports injury versus an oncology or a pediatrician radiologist, the accuracy is over 78% more accurate just reading the MRI. That's human to human.
Oh, okay.
Now, if you can take that kind of knowledge
Mm-hmm.
and include all the other pieces of information, more information either hurts you or helps you. But if you have something that's helping you find the right information to look at, you can make better informed decisions. And that's what we're doing. Better informed decisions by the professionals, by the humans. So AI doesn't make decisions. AI doesn't diagnose. What the AI is clever at is bringing the best information in front of the medical team so that they can look at it and look at it in the best way possible.
Yeah, I'm wondering if the first win is not replacing judgment, but instead helping doctors see patterns faster and with more confidence.
Well, what you said second is singularly and solely what we're doing.
Awesome.
What you
Got
said
it.
first, you're not doing it
I,
all. Again,
I'd be curious.
not,
Yeah. That distinction
not
is important. And I'd be curious which proof point matters most early on. Is it better outcomes, faster return to play decisions, or, like fewer missed related injuries?
well, if they can better diagnose an injury,
Mm-hmm. Mm-hmm.
that's the preferred outcome. Because
Mm.
better diagnosis is better treatment. Better treatment is better health to the individual. And then, since we're dealing with professional sports, when you improve the return to play timeline, it's better for everybody. But the first thing is treating the injury. Have you ever had a sports injury?
I have, yes. I mean, I'm not a
Okay.
professional, but I've twisted my ankle probably 3 times and broke it once or twice. I've had more than a few, unfortunately.
Okay. And when they diagnosed it, they
Uh,
used one or two kinds of tests
mm-hmm,
and then basically taped it up or
mm-hmm,
bound it up and said, stay off of it
mm-hmm,
and try not to hurt it again.
mm-hmm,
And whether or not you paid attention to that or not is an individual choice, since
mm-hmm.
I've done many things to my own ankles. And at the same time, while you're favoring your ankle and you're limping a little bit, whether you're using a crutch or something like that, all of a sudden your knee or your hip starts to hurt.
That happened as well. I injured myself last
And
year, big
and you
time,
go
and
in
my knee and my hip or my other knee started hurting, and yeah, because all the imbalances, I think, right, or something. Because I'm trying to compensate for that injured knee, and so as a result, everything else starts to
and then
go
you
as
go to the
well.
doctor, and the doctor starts looking at the knee and the hip as unique injuries rather than sympathetic injuries. And if they had a better way to fully evaluate everything, then you can draw a circle around, let's call it the injury radiation pattern.
Right.
And then
Hmm.
if you can identify the injury radiation pattern early, then you can better understand what it is doing and not doing, treat it in a way that protects the other areas that are trying to protect you so that you heal better and faster.
Hmm.
And ideally, heal in a way that the probability of injuring it the same way the next time is reduced. Because we all know that once you hurt your ankle, that ankle is gone forever. And every time you do something to it, it hurts again. Speaking from experience.
Yeah, that
So,
definitely resonates. I was going to say, I'm still wondering though if the real product is not the imaging layer itself, but the trust layer kind of around better clinical decisions. Like, or am I missing something there?
well, again, it's not, we're not replacing a human. We're providing the human with more information and knowledge to help them come out from drowning in data to finding relevant data so that they can improve their diagnoses in a way that right now they're drowning. I mean, the amount of imaging and the amount of data that doctors are looking at, they're drowning in it, and they shouldn't be considered data scientists. We want them to be our medical professionals. So if we can give them tools to help them go through the data and the images that they have, it helps them in what they're doing, and it helps us in what they're doing for us. So having the technology find the patterns that you mentioned helps the doctor more quickly assess the injury rather than the doctor having to go through all the images to identify the patterns first and then figure out how bad the injury is.
And Gary, I'd love to hear what the first kind of clear proof point looks like in the field.
Well, the clear proof point, as I said, we're working with a team of sports medical professionals that are doing this manually,
Hmm.
and they intend to take our technology and put it side by side with what's being done manually and allow them to see, can it do what we're saying it does, and help us improve what we're doing, because we're not replacing anything. What we're doing is saying, can it do this? And if it can do this, then actually what they're doing can scale, where right now the scaling is limited based upon the number of humans that they have with the knowledge that they need.
That's really interesting. So, Gary, I guess help me land the plane here. So, where do you want the company to be in the next, let's say, 2 years?
Well, I think where we would like to be is helping. So our first target area is in professional soccer, and we can move out of US to global. And one of the interesting things that comes out, unfortunately, in the sports page at the bottom is how many college athletes hurt themselves and don't make it into professional sports, but still need to continue in their lives, you know, with an injury. So the number of college sports players, individuals that when they're there, if they could be better diagnosed and better treated, would give them a better life in terms of not having to worry about an old sports injury.
Got it. Great. And then I guess last question, Gary, what's the kind of the one thing you want a founder or investor watching this to take away?
Well, I mean, from an investor perspective, we feel that this is a great opportunity. And because of what we're doing and how we're doing it, I don't have to compete with people wanting to dig big holes in the ground and build data centers. This is a software application. And
Actually, I did.
founders,
Oh, sorry. Continue, Gary. Finish up,
And
please.
the founders, founders just have to fight the good fight. You have to be there, understand, and building products is hard. Taking care of people that are working for you and building the products is important. I always tell people work-life balance is very important, and we work to live. We don't live to work.
I was going to actually ask you this, but I think you kind of answered it. But what do you believe about this market that most people building in AI do not?
Well, AI is a field of discipline. It is not a thing. And I believe, and unfortunately, people misunderstand what artificial intelligence is. And we should be very careful that we understand the first word is artificial and the amount of intelligence that it brings to the party. If you're buying a shirt online and the clever place that you buy it from tries to sell you another shirt, where's the intelligence? Why doesn't it know you have the shirt and is trying to sell you pants or a hat or underwear? So when we think about what's really intelligent as opposed to just maybe excessively clever, I think most people are confused.
Someone who speaks to 30, 35 founders a day, I concur. I think most people are very confused. They're either like super scared of it or they're just like perplexed and totally confused by it. Anything else, Gary? Where do people learn more about your company? Where do they learn more about you? Are you on LinkedIn? Maybe help me land the plane for once here.
Well, I'm very much I'm on LinkedIn, so that's easy to find. It's Gary Olson, and if you look up Gary Olson, either at AI Vigil or, unfortunately, my background is broadcast technology, and I have a patent in streaming media, so I apologize that we can see each other. And AIVigil.com, AI-vigil.com will bring you to our website. And that's the best places to find me. And I don't know if you post my information, but I'm happy.
Do you want to give me do you want to give me the website one more time? Sorry, AI Vigil.
AI hyphen.
Hyphen Vigil. Yeah, Vigil. Yeah. Dot.
And there should be a nice picture of Andromeda there.
I'll pull it up here. And then, are you on LinkedIn as well, or?
I am. I'm very much on LinkedIn.
Awesome.
There you go.
Awesome. And then maybe I'll just okay, sounds good. And I'll just quickly, maybe you said you've got let me see here.
Did you find me on LinkedIn?
Here, is this AI? Just make sure. Yeah, I did. I was just gonna say, is this the right website?
Yep.
Making the invisible visible with AI. I say that all the time. I love that saying in general. But okay, well, people can learn more about it here. Thank you, Gary, for your time, and thank you all for tuning in live. We've got a couple more interviews today. Stay tuned. Gary, hang out for 1 minute. I'm gonna bring the stream to an end. I'll see you on the other side.
Great.